Welcome, future nurse. Today we're diving into the crucial skill that you'll use throughout your career. We're talking about writing effective nursing notes. Whether you're in clinicals or on the job, mastering this skill is key to providing quality patient care. So, why does it matter? Well, let's start by understanding what nursing notes are and why they matter. Nursing notes are detailed records of the care that you provide. They include your observations, assessments, diagnoses, care plans, interventions, and evaluations of patient outcomes. These notes are vital for tracking patient progress, facilitating communication between healthcare providers, and even healthcare insurance companies, also ensuring legal and regulatory compliance. Now let's break down how to write effective nursing notes. Step 1 is to verify the correct patient chart. Always double-check you're documenting in the right record. This simple step can prevent some serious errors. Step number 2 is to tell the patient's story. Remember, your notes should paint a clear picture of the patient's condition and care provided. Think of it as creating a narrative. Step 3 is document real-time observations. Always take notes as soon as possible to ensure accuracy. Don't rely on memory alone. Step 4 is to use complete phrases. Avoid abbreviations that could be misinterpreted. Remember, clarity is key. Step 5 is to remember to document safety checks. This includes any safety measure in place to protect the patient. And step 6 is to use the standard acronyms. Familiarize yourself with common acronyms like SOAPI and even DAR, and we'll explain those in a moment. Now, what should you include in your nursing notes? Well, it should start with patient information like name, age, and gender, the reason for the visit and chief complaints, also observations and even treatment plan, as well as the patient's history, medications, and ending summary. Remember, your notes should be concise yet comprehensive. Now let's look at some common acronyms used in nursing notes. Starting with SOAPI. S is for subjective. This includes patient statements. Next is objective assessments. This is measurable data like vital signs. A is for assessment, basically your analysis. P is for plan, like that treatment plan. I is for interventions, basically the actions taken. And E is for the evaluation, the outcome of the interventions. Now let's try the example together for SOAPI. S is for subjective. Remember, this is patient statements. For example, I've been feeling short of breath for the past 2 days. O is for objective, measurable data. For example, the respiratory rate was 28 breaths per minute. The O2 saturation is 88% on room air. And the blood pressure is 150/90. Next is A for assessment, your analysis. For example, the patient shows signs of acute respiratory distress, possibly due to exacerbation of chronic obstructive pulmonary disease. That's COPD. Now, P is for the plan. Remember, the treatment plan. So, for example, administering supplemental oxygen to maintain the SpO2 above 92%, or even begin bronchodilator therapy via nebulizer. Also, monitoring respiratory status and vital signs every 2 hours. And even educating patient on breathing exercises and smoking cessation. I is for interventions. Remember those actions taken. For example, administering O2 at 2 liters per minute via nasal cannula, administering albuterol nebulizer treatment, or even providing education on the use of incentive spirometer. Now, E is for evaluation, the outcome of the interventions. For example, the patient's respiratory rate decreased to 20 breaths per minute. The oxygen saturation improved to 94% on 2 liters of oxygen. And the patient demonstrates proper use of incentive spirometer and expresses understanding of smoking cessation benefits. Now moving over to DAR, D-A-R. D is for data. This includes subjective and objective information. A is for action, what you did. And R is for response, how the patient responded. Now let's try an example together for DAR. So starting with D, the data. Remember, this is subjective and objective information. The patient reports shortness of breath, or respiratory rate is 28 breaths per minute. or even the O2 saturation is 88% on room air. Now, A is for action, what you did. For example, you administered oxygen at 2 liters per minute via nasal cannula. You also administered albuterol nebulizer treatment. And lastly is R for response, basically how the patient responded. So for example, the patient's respiratory rate decreased to 20 breaths per minute, or even the O2 saturation improved to 94%. Another example is the patient verbalized understanding of breathing exercises and demonstrated correct use of the incentive spirometer. Now moving on to some general tips for writing great nursing notes. Remember, you need to stay on point and be specific. Use short sentences for easier reading, and always include all relevant team members. Next, remember to use bullet points when possible, sign each entry with your name and credentials, and use correct grammar and spelling. Oh, and always update information throughout the patient's visit. And very lastly is don't forget the small details. So remember, effective nursing notes are all about clear communication. They help to ensure continuity of care and can even protect you legally. As you practice writing nursing notes, keep these points in mind. First, be objective and factual. Next is to write legibly if using paper charts. And always be timely in your documentation. And very lastly is to always maintain patient confidentiality. With practice, you'll become way more efficient and effective at writing nursing notes. This skill will serve you well throughout your nursing career. So thank you so much for joining us today, and keep practicing, and always remember, your nursing notes are a crucial part of patient care. Happy note-taking, future nurses. Thanks for watching. Did you know you can unlock beautifully handcrafted study guides, packed with key points and memory tricks from all our videos? Plus, you'll get access to over 1,200 exclusive videos not on YouTube, all neatly organized by nursing school topic, to make that complex nursing knowledge actually stick. You'll also gain thousands of practice questions written by current professors and actual NCLEX writers. So for access to all this and more, click right up here or visit SimpleNursing.com. And don't forget to subscribe to our YouTube channel. Happy studying, and we'll see you in the next videos.